All right, so we are going to be looking at the arteries of the lower limb of the pelvis and the leg. All right, so here we are looking at the abdominal aorta. The aorta, thoracic aorta, is going to run from the heart through the center of the chest and the abdomen. Okay, it's going to, once it passes through the diaphragm, it is then the abdominal aorta. It is the largest blood vessel in the body. If you have an aneurysm and a ruptured abdominal, specifically aortic aneurysm, this can cause a life-threatening situation due to bleeding from such a large major vessel. Next, we have the celiac trunk. So remember, the trunk is like a base, kind of like the base of the tree. So this area here with the little knobbies here that are poking out, that is going to be the celiac trunk. It's a major artery that supplies the foregut of the gastrointestinal tract. It's going to branch from the abdominal aorta around the 12th thoracic vertebrae, and it's going to have three major branches here, and that's what these three little stumps are representing: the gastric, the common hepatic, and the splenic arteries. Okay. And so those are, you can see them a little bit better here on this one. Sometimes they're a little bit different on some of the models, but you can kind of look and see where they're going. First here is the common hepatic artery. Hepatic refers to liver, and you only have one liver, so you're not going to include a right or left here. The same goes for the aortic and abdominal aorta, sorry. So remember to pay attention when it's paired and when it's not paired. If it's paired, you need to say right or left. If it is not paired, of course, you would not include that. So the common hepatic artery is going to be the largest branch of the celiac trunk, and that is this one right here. And it's the only one that courses to the right, all right, so remember that's the patient's right, across the epigastric region of the abdomen, okay? And so you can see that here on both of these pictures. Next, we have the gastric artery. And so gastric, of course, refers to the stomach. And so this is the first and the smallest branch here of the celiac trunk. And it's going to go along the lesser curvature of the stomach and join together with the right gastric artery. Okay, and so gastric artery will be the top one here. And oftentimes if I draw it, sometimes I draw it on the board in lab classes and it's kind of wavy looking, and it's going to go over towards the stomach. The last of the three is the splenic artery, so it's going to be the one here on the right. So hepatic, gastric, splenic, okay? HGS. Find you an acronym to remember those, okay? Because those can be hard. And we'll also have the superior and inferior mesenteric as well. All right, so the splenic artery is unpaired, coming from the longest branch of the celiac trunk, and it, of course, supplies the spleen. It also supplies portions of the pancreas and the stomach. It's going to run anterior or in front of the left kidney and the suprarenal gland, and a little posterior to the stomach. All right, so here's a nice close-up view showing you all of these. Remember, I'm pointing to the center area here, so that's the base, so that's the trunk, so that is the celiac trunk. The one branching off to our left, or the patient's right, is the common hepatic artery. At the top, going up, so it's going up towards the stomach, is the gastric artery, and that's going to be the left gastric artery. And then here over on our right, or the patient's left, is the splenic artery, so it's going to go on off towards the spleen. All right, so here we have the suprarenal artery. What does supra mean? It means above, and renal is referring to the kidney. So this is the artery that is going above the kidney, to the gland above the kidney, okay? You can see it really good in this picture here. The next little stump, as I like to call them, because on the models they do appear as stumps. Of course, in the body, they're not stumps. But so we're going to have the superior mesenteric artery. So superior meaning above, is going to come from the abdominal aorta at the level of about the lumbar 1, L1, and just below the celiac trunk. So it's the first one below the celiac trunk. Is going to be above the renal arteries, okay, and it is going to supply the midgut. Here we have the inferior mesenteric artery, which supplies the hindgut, okay. Right, so the renal artery is a short paired artery that arises from the lateral or side of the aorta. It gives off several small branches, and then it divides into anterior and posterior branches in the hilum of the kidney. The function is twofold. It's going to supply the kidney with oxygenated blood in the parenchyma, and also deliver blood to be filtered by eliminating some metabolic waste and excess water that's reabsorbed minerals and nutrients. All right, so next we have the gonadal arteries, and these go to the gonads, which are going to be ovaries in the female and testes in the male. So we can also call these ovarian arteries or testicular arteries. You can see they're paired. They're highlighted in green right here on the picture to the left so that you can see them a little bit better. So I've already mentioned this one, but this is going to be the third main branch from the abdominal aorta. It's going to be located near about L3, lumbar 3 vertebrae. It's going to supply the large intestine. This is the inferior, so we've got superior mesenteric and then inferior mesenteric artery. So we're going to move on now to the vessels of the pelvis and the lower legs. All right, so now we're going to look at the common iliac artery. This is paired, so you have one on each side. Common structures, when they have the name common, they're usually going to split off into things like the internal and external. So it's going to bifurcate or split into two. So the common iliac artery, and you're going to have a right and a left, are about 4 centimeters long, and they begin as a branch off of the aorta. And run along the medial border of the psoas muscle, all right? And then they're going to split or branch off into the external iliac artery and the internal iliac artery around the pelvic brim right in front of the sacroiliac joint. All right, so this picture here on the left is the arrow is pointing a little more accurately. So you've got your common iliac, and then you're going to have the external iliac here, and then of course the one more internal is the internal iliac, okay? So this is a little bit better picture here. So this would be the right, and then this side would be the left external iliac. Here you can see the internal iliac, okay? And on this one, up here is your common, and then you have the external going down here, and on this one, the internal is pretty much just this little stump here, okay? Don't forget to use right and left for these, the patient's right and left. All right, so here we have the femoral artery. This is the main blood vessel supplying blood to your lower body. It's going to start here in your upper thigh near the groin, okay, and then it's going to run down towards the back of your knee, where it's going to branch into some other arteries here, one of those being the deep femoral on the side. And it's going to basically supply through some of these other vessels that are branching off of it. The whole lower leg is going to branch basically off of this one. All right, so here we have the deep femoral. So you will have the femoral, and off of the femoral artery, you're going to have this branch. It's a pretty large branch called the deep femoral. It is going deeper into the tissues, all right? So it is more posterior or deeper than the rest of the femoral artery. So once that femoral artery reaches the knee, it becomes the popliteal artery, okay? Popliteal means behind the knee. So it's going to run here. This is kind of showing it on the side on this board, but in the leg model here, you can see that it is actually behind the knee. So that's something to remember, of course, with your blood vessels as they pass certain locations that you are going to give them a new name. So now we have the anterior tibial artery. Of course, anterior means in the front. Tibial is letting you know that it's going to be continuous or near the tibia. And so this is an artery in the lower leg carrying blood to the anterior compartment of the leg. It's also going down towards the dorsal surface of the foot. All right. And so anterior tibial. Once the anterior tibial gets down here towards the foot, or the dorsum of the foot, we're going to call this a dorsalis pedis artery. Okay, so this is the dorsal artery of the foot coming from the anterior tibial artery. It's the only one in the foot that we're going to learn, and it's a little distal to the ankle joint. All right, so here we have the posterior tibial artery, and this is going to be a branch coming off the popliteal artery. It's going to supply, of course, the posterior compartment of the leg and the sole of the foot. You can see it, of course, along here on the back side of the leg. It's very long. Now we have the fibular artery, which is also sometimes called peroneal artery, and you'll see that in parentheses. It doesn't mean you need both names. That's an alternative name, okay? So this is a branch of the posterior tibial artery, and it supplies the posterior and lateral or on the side compartments of the leg, and it is going to be distal to the popliteal or popliteus muscle, and be on the medial side of the fibula, okay?